share a little bit, kind of from a personal perspective, and then what you've seen in terms of the role of activism? I mean, we've seen a lot. The last month has been kind of a kick month here, and a lot on cancer groups. How do you see the role of advocacy and cancer activists?
Thank you so much. I'd like to first thank Felicia and Jono and everybody for the opportunity to be in this panel. Just want to tell you a little bit about myself. I'm a nurse and a teacher by training, but I never thought I would grow up to be a cancer advocate. In 1989, my stepson Max was diagnosed with leukemia, specifically with CML, chronic myeloid leukemia. So in 1989, this was a very different disease than it is now. And we were told if we were lucky, he would find a donor, and if we were even more lucky, he would survive a transplant. So we searched around the world for a donor for 22 months, and Max lived very courageously with CML for 3 years, and he passed away in 1991 when he was 17. So we started the Max Foundation because we thought that we had learned so much, and we never wanted any other parent to have to go through what we went through alone. This was before the internet, we forget. So it was very different to be a parent and to be a patient back then. So our mission is to improve the survival rates of people living with blood cancer and rare cancers worldwide. And because we were from Argentina, we always focus on the most vulnerable populations around the world, especially in low and middle income countries. And so if I fast forward to now, 2 weeks ago I was in Addis Ababa in Ethiopia at the Black Lion Hospital. And we had managed to perform the first molecular test to be able to confirm the presence of the BCR-ABL, which confirms the CML. This was the first time that a molecular test for a cancer was done in Ethiopia. And you could see the incredible ripple effect that was happening in the healthcare community in Ethiopia. We have been treating CML now for about 10 years. There's about 300 patients that are on treatment. These are the lucky 300 who had been able to come up with $700 to send their blood sample to Germany so they could confirm that they had the disease so that they could get on treatment. And those 300 that were the lucky ones were never able to be monitored to see how their treatment was going. So this was, I think, a great opportunity. We did it with equipment that not only can diagnose CML, but it's a rapid test technology that can be used also for diagnosing drug-resistant TB and about 100 other infectious diseases. And we took the moment to celebrate, so we organized an event at the Children's Ward. We thought this was a great opportunity to bring awareness of the situation with childhood cancer in Ethiopia, which is very difficult at the moment. So we brought the media, we brought the representative of the Ministry of Health, the doctors to explain what cancer was, and the parents of the children. And this was the first time in Ethiopia that the representative of the Ministry of Health sat with the parent of the children and the media present. And there were, of course, a lot of speeches, and then there was a moment for question and answer. And one of the parents stood up and he said in English, for my benefit, I think, cancer has no answer. And he went on to say, until today, when I heard the CML story, I thought cancer had no answer. But now I think that there's a hope. And then went on, one by one, all the parents stood up and asked the Ministry of Health for what they need, access to the medicines that they need to have them close to their communities. And so I think that this is a great example of what we have been talking today. We have been very privileged for the past 10 years to be able to facilitate access to treatment for CML in many, many countries around the world, but we have really leveraged that opportunity to advance advocacy. We have worked with patient leaders and survivors and formed patient organizations in about 25 countries. We have been able to strengthen delivery systems. We have done health education. We have trained physicians. And really we have brought everything we could from the platform we had. And thank you for telling me that this is called a diagonal model. Now I have the word